Welcome, everybody, to the Eat, Pray, Faith podcast with Dr. Tracey. That's me. And today we have an incredible topic on women's health with my very good friend and expert in more than just that, and so many things, Dr. Maribelle Verdiales. She is an MD, ND. She also, as I said, is a women's health specialist, fertility specialist, and hormone management specialist for both men and women. Today, we are actually going to be talking about female hormones, pregnancy success, and beyond. We're going to talk about some complaints within the industry that Dr. Verdiales has really taken to heart and has changed the scope of what she does and functional medicine to bring better care to women. And we're also going to discuss some incredible formulations that she uses in her practice, as well as some that she has formulated herself with our good friends at Nutritional Frontiers and Jamie Dorley. So I can't tell you how happy I am to have you here, to have your
Oh, thank you so much,
expertise.
Tracy, for having me.
Would you mind just giving our audience a high level who you are and how you got to where you are today?
Absolutely. So, we've talked about this on a more backstage way, but I'm originally from Puerto Rico, so that's where I did my medical school. Decided to become an OBGYN because through my first years in medicine, realized that women we were talking about this earlier, underserved and misunderstood. And so I wanted to make a difference despite my father almost falling flat on his face. My dad was a lawyer, and I came home one day, Dad, I'm going to be an OBGYN. And he was like, oh my God, that's the funniest thing that has ever come out of your mouth. Um, one, I love to sleep. Sleep is my number one priority. And, historically, um, OBGYNs don't sleep. And two, being a lawyer, he's like, really? Couldn't you be a dermatologist? Something else, less litigious? So I said, no, I'm going to make a difference in this world. So that started about 23 years ago. And that took me to do my residency in New York City. That was an adventure all in itself, coming from the Caribbean. And I'm very happy and glad and proud that I survived New York. Because if you can make it there, you can make it anywhere. And I can attest to that. And life brought me down to Georgia, where I've lived in practice and been for the last 15, 16 years. Why did I become the doctor I became? I guess that seed of wanting to make a difference and just trying to find true solutions to the challenges of everyday life took me to become a doctor. And then eventually, due to some personal experiences with loss, including I am a widow. And so my second husband was diagnosed with terminal rectal cancer at 37. And at first, just like everybody that has been impacted by such a diagnosis, it doesn't matter what degree you have, it hits home, it will shake you to the core. You think cancer is somebody else's problem. And so I had to take upon myself to learn how to deal with it. When you get a diagnosis like that, either you put your head in the sand or you roll up your sleeves and make it your own and said, okay, I'm going to own this and I'm going to, tackle it and understand it so I can deal with it. And that was my approach. The first year of treatment, mostly out of just pure ignorance and innocence is not bliss in this world, unfortunately. We did exactly what we were told, chemo, radiation, probably 32 interventions with everything that entitled, just to end up worse than where we started. And so that took me first. It was to learn about cancer. That was the trigger to push me towards more holistic, natural, integrative, functional medicine. And eventually, as I learned about cancer and cancer, immune supporting herbs or clinical nutrition or what else could we do, since the prognosis was so dim, even from the very beginning, um, then once you start going that rabbit hole, then you start understanding how really the biochemistry of the body works, how really the immune system works. And unfortunately, a lot of these things are not addressed in traditional medical training. So I felt very, very lost at the beginning, almost like I was back to first year of medical school being bombarded with information. And then once you start understanding all of that, then you start seeing the connections with chronic disease and what different levels of disharmony it's going to provoke in the metabolic balance of our systems, how our bodies work. Okay. And it's all related when you go down to it, whether it explodes as a cardiac issue or whether it explodes as an autoimmune disorder or it explodes like cancer. The root causes of a lot of these issues are very, very similar. So once you understand the basic concepts, then you can tackle pretty much anything. I have learned to understand that we're perfect. We are in the image of the creator. This biological bodies, this condensed light, that's what matter is, it's perfectly designed to self-regulate, self-heal. And unfortunately, because of the lack of that true understanding, a lot of times the allopathic approach is that we're broken. And so it's all based on quick fixes, and that's not going to be long lasting. So
Right.
long story short, after he did pass 2013, he did last 4 years. He was the prognosis at diagnosis was 6 months, and it was not the chemo or the radiation that kept him alive for 4 years. It was a lot of prayer and a lot of experimentation and a lot of miracles that I saw as I would learn about something, try it on him, learn about something, try it on him. And I mean, you cannot unlearn things. There's certain things in life that will change you forever. I could not go back to the doctor that I was. And that shifted my mindset completely permanently. And so I dove into more learning and decided to go for a degree, to make it official. I guess is the medical doctor in me. I wanted to make it official. So I went back to school and finished the degree in naturopathy in 2017, and just being, learning and going, and pretty much same approach is being still happening. So that's me in a nutshell.
Well, that's quite a story because I think you live a lot of what people experience
Yes,
as both a physician and on the other side with someone that you love as a patient. So we are truly
absolutely.
sorry for the loss of your husband. But all glory to God and how he has used it,
Correct. I think
set you
that
on your path.
yeah, I mean, I tell people all the time, especially my patients, from a faith standpoint, if you see life through the eyes of the creator, the things that happen in our path are truly just lessons. And if we believe that we're incarnated here temporarily and we'll go back to where we belong to, then this is just a lesson. It's like being in school, whether you believe in reincarnation or not. It's still a school. You come in, you learn certain things will arise in your path so you can change, grow, evolve. I mean, that's how our universe is it's a universe of challenges, right? You see nature, the fittest survives. It's like there's always this challenge that has to be overcome. And so that happens even with us. It's like the challenges that might be showing up in your life are not punishments or lessons for growth and for helping others overcome the same lessons that might arise in their lives.
We all definitely have a different path to walk. And I'm glad our paths crossed though, because
I am very glad.
we met through Nutritional Frontiers. And as we mentioned in the beginning of the show, Jamie Dorley and his staff, Christine Genovesa, and the whole team is great. And Dr. Verdiales and we have been lecturing a lot over the last year together for Nutritional Frontiers.
Absolutely.
and have formulated different products for them. And we're going to talk about some that you've helped formulate there, which are fantastic.
Mm-hmm.
But I want to get into the topic here, just about, what we're going to talk about with women's health, fertility, and beyond. I think for me personally, I look at the scope of women's health in general. And just like you, as I learned more, because as natural and holistic as I have been my whole life, as I tried to be, when I was 13 years old, I was taken to the gynecologist and put on birth control because I had irregular periods. And then, you go back and you have your regular appointments and they're doing their little pap smears and everything else. And all of a sudden you have abnormal cells. Or if you want to
Mm-hmm.
IUD put in, I mean, that was torturous. There's birth control that's put out. Then there's new things that are put out, like the
Correct.
Depo-Provera shot was
Provera, which
big
to me
when
is
I
the devil.
was. Right. So, and you don't question, you don't ask. It's super robotic for women.
It is very robotic for a lot of doctors too.
Exactly. And so now we're going through this whole system, and then all of a sudden you hit 40. At
Mhm.
45, you start going through some perimenopause, maybe some menopausal symptoms. Suddenly you're on the mammogram chain. You have to get one every year. And nobody ever questioned it. And
Correct.
I had two other female healthcare professionals. One was a hormone specialist, the other one was a specialist with thermography, and just come in and give me different perspectives. And as I talked about it, I was like, my gosh, it's like you said, misunderstood
And
and
underserved.
and underserved. I'm like, this is like straight up abuse. Like, what's
Yes.
happening? And then don't even get me into the pregnancy birthing experience that's
Oh,
become
Jesus Christ.
a
Woo.
whole medical issue, right?
Uh-huh.
It's a natural experience. So I love that you're here because you've lived both sides. And I see, just from the way you talk about what used to occur and what occurs now, you don't dwell back there in the past. Like, it is what it is. You've
Mm-mm.
learned what you learned. What you did was stop complaining and you just fixed it moving forward and made your own way with your own patients. So I want women here
Correct.
today to understand that there are people like you out there that can
Mm-hmm.
serve them and their needs. They're not crazy.
Mm-mm.
This isn't normal. Like, things that they're experiencing are real. So if
Absolutely. They're
anything, I
real.
hope people feel vindicated after listening to you.
Yes. Yes,
But
absolutely. So it's like, once you get to my age, and I call them, I
29.
love, I just turned 30. Um, so, you see also life from a different perspective. I call them my veteran women. I have birthed 5 daughters. So I also have every experience that you can go through in terms of birthing. Including the failed birth plan that ended up in the C-section, of course. And I've experienced being the caretaker. I've experienced being the patient. Now I'm experiencing being the mother of a patient, and it's crazy what happens out there.
Mhm.
Now, on a brighter side, there are more and more of us in the healthcare field, not only in the naturopathic arena, but even in the nurses, midwives, PAs, doctors that are they're getting out of the matrix. They're waking up. When I started trying to learn about this stuff. I was going to some seminars. I was the only doctor, and then everybody would just migrate to me and look at my badge and go, "You're an MD? What are you doing here?" I
You
was like,
doing here? Yeah.
I want to learn. I'm sorry." But it was mostly acupuncturists, chiropractors, NPs, naturopaths from all sorts of ways in life. And now I'm seeing more and more of the awakened coming in and understanding, because the reality is that doctors, people that go into medicine or any sort of trying to help other human beings, they have good intentions. They're just misinformed. And they have drank the Kool-Aid. They're stuck in the matrix. A lot of them don't even question the matrix. What I've realized in my 23 years as a physician is that this is what you do and this is how it goes. And they don't even know, like, the true effects of the medications that are being prescribed, the long-term effect. I've seen medications come out as the new kid on the block and the salvation, and then fall out of grace to be the most horrible thing that
Right.
causes birth defects, and you're going to have a baby with a third eye. I've seen it. I've seen it all. And I'm happy to say that there's more and more people kind of waking up. And once you drink that blue pill and get out of the matrix, you can't
Mm-hmm.
just, the veil has been taken off, and then you start seeing things completely differently.
Mm-hmm.
And so in terms of women's health, I agree. The stuff that I saw, especially as a medical student, was horrific. I mean, to the point that I was like, I have to do something.
Awesome.
And that's what, we were talking something simple as, hey, not all vaginas are the same, right? We're not all same one size fits all. So why are you going to use the same speculum on every patient that shows up the door? What if, that patient has never had sex? How about patient that has not had sex in 15 years? Like you get, some of the older ladies, um, they should be treated, kindly and appropriately, same thing as procedures. If when I was under training, and this is something that we were just briefly talking before the podcast was on, you did all these procedures on women in the office with not even local anesthesia. That's brutal. I mean, why? Why are we expected to go through? That's abuse. That's simply
Amen.
abuse. And so I have shifted so far away from that. So it's like I'm very open with my patients about, look, if you have a very low pain tolerance, if you're feeling very anxious, it's going to make the pain even worse. So I give them oral sedation as long as they have a driver for whatever procedure, biopsy, etc. I use local anesthesia very generously. And I tailor that's the whole point of functional medicine, tailor to that patient. We're
Yes.
not one size fits all. And that can be extrapolated to everything else. So, yeah. So, in terms of, women's health, um, the, I've heard physicians say, "Oh my God, that patient is crazy." Is she? Is she crazy, or she's just, a little off? Like maybe there's
Yeah.
something that has a easy resolution with a little bit of understanding. And that was kind of where our topic for today was. It's like I just wanted to go over kind of the main points, like the 5 biggest thing that will take a woman to see some sort of healthcare provider, whether it's a GYN, primary care, naturopath, it will drive them there.
Well, let's do it.
So,
Let's get into it.
all
So
right.
let's
So
start. Common
the
common complaints.
yes. So like the one of the main ones is the psychological, emotional component of some of these hormone imbalances. Um, so either somebody comes in and they'll say, I don't feel myself before my period. So that's part of, the premenstrual syndrome type of family. I don't feel myself. I notice not only they might have physical symptoms like bloated, breast tenderness, constipation, etc. But we are tough cookies. We suck that stuff. But when we feel out of it and crazy, and we as adult women identify it, that will take you to the doctor. Be like, help me out. I feel crazy. And
Yeah.
then you have the perimenopausal patients that are going through the same kind of shifting in their bodies. And some of them won't have that shift in an elegant way. And we can talk about that later. But I'm not myself. I'm having these crazy mood swings. Yes, they could be the physical hot flashes, night sweats, etc. But it's like the the uh, and so they come in because of all the more psychological, emotional component of whatever they're experiencing. And then you have the patients that come in with menstrual problems. That's another big one. Women will tolerate scant periods a lot more than heavy periods. I don't think that there is a female in this planet that adores her period and goes, yes, I'm bleeding. I love it.
It's also even
So
the way that you're taught about it, right? I mean, it's like this horrible thing that someone has to sit down and tell you about. Most of the time, like I'm Gen X, so I grew up, we didn't know anything. All of a sudden I thought I was
you started
dying.
bleeding.
Right. And
Correct.
I ran out, my mom was like, oh,
Oh, welcome to
so,
this thing.
yeah, and it's gonna be horrible and you can't go swimming for 7 days. I was like, I can't go swimming, like,
Really?
growing up as
And
a
now you
toddler.
have to wear, now you have to wear a diaper between your legs. It's like, what?
Right,
I don't want
exactly. Yeah.
my legs. So yes, I think part of it's teaching, and part of it is that it is uncomfortable. I mean, I prefer not to have one if I could avoid it, but that's not how we're designed to be.
I think
And I
it's
think part of it
interesting,
is,
doctor, that you
yeah,
said like women will tolerate not having a period. And actually, it's such a great point to bring up. Maybe you can circle back when you go into this topic a little deeper. But there's a lot of medications that stop menses,
and and that's where I was going with it.
Ooh,
That's woohoo, that causes so many problems. So I think that you hit the spot in terms of teaching. And if as women and as girls, and I mean, ultimately, I mean, women do run the world. We just have to kind of shift that mindset. But if we see our menses at actually a celebration of life, which is what it is, it's a practice, as your body's practicing to be ready to, harvest a baby. So that might help deal with, the part that's uncomfortable about the bleeding and what does that entail. But and women love not to have periods, and you hit it as well. There are medications out there, and especially on the contraceptive side of things, to decrease periods and to completely block that system. And it's so sad. I do wear multiple hats, and one of them is I'm the medical director for the satellite office of a large fertility clinic.
mm,
And I had this discussion yesterday with a 30-year-old woman with a dismal ovarian reserve. She went to the pediatrician at the tender age of 14 with irregular periods, was placed on birth control, which was she felt it was very convenient. So she was on birth control for 12 years. Okay. And now she's off birth control. She tried to get pregnant for year number one, finally went to her regular doctor, and eventually ended up in my office. And I'm discussing with her, honey, you're 30, but you have the ovaries of a 60-year-old. And if you think about what would happen if you grab an arm and tie it up and not use it for 10 years, it's going to atrophy.
wow.
Is going to atrophy. So we're harming women by doing this to teenagers and young women, putting them on this blocking type of stuff. We are not designed to do that. We're designed to practice every month. We're designed to move. If you don't use it, you lose it. We're designed to use our bones. We're designed to, lift stuff. We're designed to be outside. Use your bones, use your muscles, your joints. Well, how about your female parts, right? They need to work. They need to keep, keep doing what they do every month. And
Yeah.
maybe if we started seeing it as a celebration of life, celebration of the potential of life, again, maybe it would be easier, especially for the younglings to, accept this new thing that comes in with being a girl.
Right. Totally. So let's talk about the psychological issues with menstruation, because not even that, but one of the other areas is postpartum depression. So I think if we're
Mhm.
talking about PMS, menopause, and or
Yes.
postpartum depression, what I see mostly is that women are put on some sort of antidepressant or
Mhm.
psychological pharmaceutical without any blood work to look at
Nothing.
the hormones.
Zip.
Why are the allopathic doctors in this scope? Are they trained to look at
No, they're
hormones?
not.
I mean, that
It's
blows my
crazy.
mind.
It's
Next
crazy.
to next to psychiatry, which is another one that just prescribes medications without blood work.
Candy.
I mean, they just pass them. Oh, didn't work. Let's try another one. Oh, didn't work. Same thing with birth control. Same thing. I mean, it's really wild.
It's it
So
is wild. And I didn't realize how um how do I say it in a nice way? Ignorant we were as a community until I started really, learning about how to really read hormones, how the interactions are, the precursors, how are they made, where are they processed, all of that. I actually did not learn in medical school at all, and in residency either. I mean, most of the residency for OBGYN is focused on very basic understanding of female hormone, surgical management. Kind of half of it is surgical management of issues without necessarily looking how to fix the problem instead of, dunking the uterus, for example. And then management of drugs. The rest I had to self-teach after the fact, and it just blows my mind. And yes, again, the emotional component, the psychological component of having hormonal imbalances, it's what drives a lot of women to the doctor. And it's sad that instead of, hey, let's see what's happening inside your body, see how can we help your body correct it, they get put on all of this other medication with other issues that come along with them, short term and long term. And it might have been a very, very easy fix. Um, so, which eventually we'll talk about the UTR
yeah.
supplement and its benefits for postpartum depression.
Well,
You've
we
never
can talk
seen,
about that right now. You can interject that
boom.
anytime. So
So if you look, sometimes humans think that we're kind of finding new things and we're recreating the wheel. If you look at what happens in the natural world, in our planet, all mammals eat their placenta. There has to be some innate wisdom in that. You don't see a horse depressed and rejecting their baby because they're in postpartum depression. The placenta, even though it's a fetal organ, it is a very, very interesting organ. It is the buffer between the mother and the fetus, such that the mother does not reject the baby as a foreign object. So it is an immunomodulator. It has immunomodulating capacity, not suppressive, but modulating. So one, it protects the baby in terms of immune support. And because of those factors, if the mother were to ingest her placenta, she would benefit from that side. Two, it also helps. I like the word immunomodulating because it kind of brings it in balance, right? So, also with inflammation and other things that could be happening in the postpartum period, that it's going to be ameliorated by placenta ingestion. Sounds kind of gruesome, but it's actually not.
well, it's
Um,
we take lots of glandulars and a lot of organ meats, liver,
exactly,
the spleen
exactly.
glandular, thymus. I mean, there's all kinds of stuff. And just to run through the label real quick, because this was a formula by Nutritional Frontiers. I'll make sure that we link it in the show notes. Chase tree berry, there's curcumin, boswellia,
Curcumin, boswellia.
and then the placenta bovine, which is a
Correct.
New Zealand very clean source. I mean, that's what I
Clean,
will
clean,
say
clean.
about any glandulars or organ meats that
New
are
Zealand is the place.
utilized in these formulas. So clean in New Zealand. I always look for that on the label. So continue. Sorry, I just want people to catch up what we were talking about. It's a product called UTR, appropriately
Yes,
named, and dual
yes.
formulated here with Dr. Verdiales and Nutritional Frontiers. So continue.
Yeah. So I hit it with the placenta just because I was so excited to have that in. Um, and I mean, as you know, I do have a clinic down in Playa del Carmen, Mexico, where I do a lot of cell therapy, and we use as part of the enhancements human placental extract, um, given to the patients for all of the wonderful benefits, growth factors, immunomodulating factors, peptides, nutritional enhancements in, the nutrition of the placenta itself is just, iron, minerals, peptides, protein, name it. Um, and it is actually the stem cells are placental derived for some of the same reasons that I was describing. Placental cells do not elicit the signature proteins on the cell surface that identify it as a foreign self, and that's one of the reasons that it's a buffer between the baby and the mother. So I was very, very excited to be able to add that to the formula. Then you have chaste tree, which to me is one of my favorite herbs ever. I used to give chaste tree to my teenagers as they were going through it, because unlike adult women, a lot of girls in puberty, they don't realize that they are psycho. Their mothers do. So they will either, if they end up in my office, their mother brings them because there's such a shift in their moods and in their personalities, and the girl, they're pretty clueless, but it works like a charm for puberty. It works like a charm for PMS. It works so good that I had one of my sonographers in the office come in and say, oh, one of the nurses said, go grab this because I was having brutal PMS. 20 minutes, that's all it takes. 20 minutes, and then you feel kind of the calmness come in and you feel a little bit more normal. Chaste tree not only works by balancing the estrogen progesterone ratio, but it also helps with ovarian function and ovulation. So very good for regular menses, very good for luteal phase defect. It will be a natural way of increasing progesterone production, and then therefore pregnancy support if somebody that's having short cycles, and that could be an issue, and they're looking for a more natural, less invasive way of dealing with it. Chaser would be my to-go herb, and if you combine that with the placenta, just those two together is a home run. And then you have curcumin. There's so much research on turmeric and curcumin and all its benefits, liver support, direct ovarian function, anti-inflammatory. That's why it's used so much in joint pain, but in the female track, it has all those benefits as well by decreasing, prostaglandins and precursors of prostaglandins. And so very good for painful cycles, very good for heavy cycles as well. And then in an indirect way, by supporting glutathione production and liver clearing, liver detoxification pathways, then you're going to also help with that estrogen progesterone ratio, since the liver, even though people don't see it that way, it is an endocrine organ, because it is where the hormones are processed, modified. Up in Pittsburgh, you were talking about the importance of liver and thyroid function, and that's where T4 becomes T3. Same thing with the other hormones cascades. The liver is part of the endocrine system. The liver has a lot of functions, but definitely one of them. And it is also one of our main filters. So as we need to get rid of our metabolites, the liver also plays a huge role on clearing the excess of whatever it is, especially estrogens. So very, very important to have curcumin in there. And then you have boswellia or frankincense, where again, very, very potent anti-inflammatory. It also has been linked to help with hormone balancing and supporting the liver again, which again, as an endocrine and slash detoxification organ, is crucial for every metabolic pathway that we have to go through in our bodies.
Love your liver, people. It's very important.
Very, very important.
Let's talk a little bit, switch gears, because I know we were talking about postmental, psychological. We've basically discovered that UTR is going to cover a lot of those issues. And I just had
Correct.
somebody reach out to me today, new baby, within weeks, anxiety, massive postpartum depression. And, my whole thing was like, well, what's her blood work say? What's going on? So I did send her UTR and I was like, let's do
Take,
4 day. Let's
yep.
do that for 2 weeks, see how you feel, cut it down to two. So, if people are listening to this podcast and you need any help, feel free to reach out to Dr. Verdiales or myself. I'll make sure that I link UTR. Let's talk about fertility because this has come up a lot.
Mhm.
I'm seeing more and more and more young ladies with fertility issues, and it went from a closet case issue to
Mm-mm.
an explosion. And I know that we are impatient as a society and we want what
Mhm.
we want now, but I think a lot of people try for a long time. There's a stress to it. So talk to me about what you're seeing over the last 5 years with fertility and anything that you may feel impacted it more than not. And you're free to talk on those things.
I will definitely
And then
throw
what are
out,
solutions we can talk to these young women?
right. So it's interesting. When I started my residency, and I'll go back to the residency because we can argue that in medical school I was not exposed enough to women's health. But during residency, I was not seeing the amount of fertility challenges that I'm being seen in the last 10 years. As a society, our birth rate is going down, and I'm seeing more and more problems, men and women, with abnormal parameters, abnormal fertility parameters. I mean, like the girl I just described, we're talking about a 30-year-old woman with her husband who's 32, and his semen analysis was abnormal, and she had the ovaries of a 60-year-old. I'm seeing that over and over and over and over again. And and I think there are multiple reasons as to why this is happening. One, nutritionally speaking, we're not providing our bodies what our bodies need to heal, regenerate, and self-regulate. The typical American diet, it's getting worse by the minute. There's not only what we're choosing to eat, but what the sources of our food is. Um, that is something that I have had the I don't know, the honor or the opportunity to experience getting outside the United States, eating about the same, and my body being like completely different. You go to other countries where there's no GMO. There's, you buy from the local farmer who doesn't have money for pesticides, so therefore it is organic.
Thank God.
Uh, Organic without the label and the excess price, because that's just the way they live. And inflammation goes down, joint pain goes down. I even lose weight. I'm eating I'm on vacation or whatever situation, and I'm going, wow, it's scary. Forget about the brain fog, energy, fatigue, sleep patterns. And that's something that I have shared with colleague patients that have experienced similar scenarios. I drink a glass of American red wine and I get a headache. If it's Italian, I don't. I mean, I can freaking drink a whole bottle of Italian red wine and I'll be completely fine, it just puzzles me. Even, there's the wheat thing, the gluten thing. Most gluten in the United States is junk, so I just tell patients get away from it. But from experience, again, wheat is not the problem; it's what we've done to it. And that's a whole discussion on itself. But so then you have not only nutritionally deficient, deprived people, and then you can think about the Pavlov cats, generation after generation, and then worsening diets. So it's messed up after messed up. Two, then you have what we're exposed to. So now we have a body that it does not have the biological reserve and the ability to detox regularly because it is nutritionally deprived. Now it has to have additional insults, over insults. We're exposed to so much stuff. In the environment, radiation, coloring, the stuff we put on our skin, and then over-the-counter medications, and then you go with prescription medications. And if you look at even the vaccine charts on a baby, I was vaccinated as a kid, and you look at what I was vaccinated for and the vaccine regimen I was exposed to, and I look at what is expected of a baby today, and it's crazy. It's like you're expecting a newborn with an immature immune system to create immunity to 5 different viruses at the same time, and that everybody seems to think that's
Normal.
very
Yeah.
intelligent. And I'm like, that is the most stupidest thing I've ever heard. Same thing as, and this is something I feel a little passionate about. It's like, okay, I am not anti-vaccine, but you have to do it in the right way, which it's a whole different discussion in itself. But for example, if we know that hepatitis B is sexually transmitted or by IV infusion, right? Why are we vaccinating newborns with hepatitis B? Where's the benefit? Zero. Like everything in life is risk versus benefit, right?
That's right.
So, again, so now you're having a nutritionally deprived individual that cannot process things in optimal manner, exposed to a lot more junk that are previous generations, right? So external toxins, it can barely handle the internal toxins. Now we have increased the external toxins by I don't know how much percent. And then their immune system is compromised because you have over vaccinated on a ridiculous regimen that sets you up for just a disaster early on in life. And then you see early cancers, autoimmune disorders, and some of the fertility stuff is believed to be autoimmune to some degree, you know. And now you hit the excess use of birth control. So you keep adding. Now you have when I was in medical school, pediatricians did not prescribe birth control. Pediatricians did not prescribe antidepressants. This has been something that has happened in the last 10 years or so, where you have kids that are barely their HPA axis. So their bodies, it's normal to have irregular menses on the first 3 years of since menarche, or since the first period. Why? Because that system is immature. It's figuring itself out. Let it figure itself out before you slam it with birth control pills. It's okay to have irregular cycles at 13. It's okay to have irregular cycles at 14, 15, 16. We don't reach sexual maturity until 18.
That is
And
such a great point. We should say it again. It's okay to have irregular menses.
as
Let
a
the body
teenager,
work it out, right? As a
correct.
teenager.
You know,
So
it's
it's so important. We're so mindset on being perfect, right? Everything, weight, height, dress,
correct. And
you
that's
know,
part of the
Joneses.
problem, that as a society, we want things to fall in a category. You again go back to the food. My husband, he's from Mexico, and he's a fresh immigrant, so it's almost like a child. So he's noticing the differences, and he points out, like,
Poor
here
guy.
they're obsessed for the
So
food to look perfect, right? It's okay for the apple not to be perfect. It's okay for the zucchini to be a little twisted.
oh
And
no, we
that's
actually had to develop a company called Misfits. So we could put the misfit type of vegetables and fruit into a box and then you can buy it at a discount because it's not perfect. It's
and
ridiculous.
it's and so that that so yes, it's okay to let nature do what nature does outside of our bodies. with fruits and vegetables and everything else. And inside of your body, you have a new girl that's just having periods for the first time. Her endocrine system is still figuring itself out. Let it be. Let her achieve sexual maturity the way that nature intended on her own. But now, boom, you have a 15-year-old that her system is not even fully mature, and now you're suppressing it because it's convenient for the mom, it's convenient for the child, and it's convenient for the pediatrician. And
Yeah.
then you put her on birth control for the next 10 to 15 years, and miraculously, after suppressing a not fully developed system, you expect the system to work perfectly. Like, unfortunately, my patient yesterday, that when I was reviewing the labs with her, it was heartbreaking. It was heartbreaking for her, for me, for her partner, because it's not normal. That is very not normal. But again, it just keep adding to the insult, and then now we have across the globe birth rates going down, governments in different parts of the planet actually paying people to reproduce because fertility challenges are on the rise, and that's aside from whether they want or not to reproduce. But we need to replace ourselves, otherwise we will be extinct.
Yeah, well, we won't be here. I mean, that's a big thing with education. I mean, so let's think about where this all begins. You have facilities and or organizations that create programs for women that educate them on birth control, on contraception, but they don't educate them on the beauty of the menstrual cycle, what is normal, what is not normal, letting the body mature, everything we're hearing today. You go to school, right? And there's sex education in there. Again, they're touting
Birth
birth
control.
control. They don't talk about, all of these things that we're talking about today, about the impact later of what we do to our body now. And we talk about that in health all the time. Like if you eat this now, later it's going to come back and bite you in the butt. Well, the same thing
Absolutely.
goes with women's health and fertility. And I think it's really important. So I'm not going to ask you about the COVID vaccine right yet, but I am going to ask you in 5 minutes. But for 5 minutes, can we talk about your formula fertility and a little bit about
Absolutely.
that and how you position it for women that are struggling?
So fertility, again, glandulars. I am a sucker for glandulars. Both from an immune standpoint, as well as a simply nutritional supplementation for the organ in question, like CO like. So it's like having a Ford, that's 1977, and you have another one for replacement parts. So simply, eating ovary, it's going to have everything that ovary needs, right? And that's aside from, like I said, the immune component and the cell signaling that happens in favor of the organ. There is something called oral tolerance therapy, which is you take the organ, and like I was saying earlier, we believe that most of the cases of fertility will have a subclinical autoimmune component, meaning the body detects ovarian tissue, for example, as being deficient or sick, and it's going to attack it. That's what the immune system will do, clear the junk out. So then by ingesting tiny bits of ovary, you're actually desensitizing the immune system in favor of the organ, and then you come and nourish it, help it heal, so then it will not be detected as a sick organ anymore. That's one of the beauties of glandulars as well. So then you have ovarian glandular. Then you have the NAC, which again, liver support, huge on liver support, because you cannot have a hormone balancing or testicle ovarian enhancer thing without having liver support. Ovaries and testicles and uteri are end organs. Our bodies, again, they're smart. They're non-essential organs. So energy and food will be diverted to essential organs. And so you have to support everything else before you can actually support those organs that the body
Right.
feels that it's not essential. And then you have the resveratrol, which is a potent antioxidant. There's a lot of literature on even on the anti-aging effects, and even suggesting anti-cancer effect because of its potent immune supporting mechanisms. You have vitamin D, which is considered actually a hormone, not really a vitamin, essential for ovarian function and progesterone production. So especially that second half of the cycle that I was describing earlier in terms of the chaste. Let's see, it has minoxidil, which used to be categorized as a B vitamin. It was B8. Now they realize it's more a sugar alcohol. And it helps with insulin sensitivity. So it works in several mechanisms, very good for PCOS patients. So,
Yes.
I like to call it the natural metformin. And then by decreasing insulin, then you have the benefits also indirectly of having anti-inflammatory support as well. Let's see, what else does he have in there? Oh, CoQ10. How could I miss that? CoQ10, mitochondrial support and oxygenation. And if you think about what happens in reproduction, so CoQ10, fertility, even though it has that name, I like to see it as the ovarian support. Okay. And so on the older crowd, it will also have the benefit of having cardiovascular support. And all of, the first research on CoQ10 was actually on cardiovascular health. But, we need healthy mitochondria from head to toe anyway. And in the ovary, mitochondria is even more important because it will be the egg that provides the mitochondria for the embryo. So not only will be important for the actual functioning of the ovary and the egg, but also for pregnancy success, because the sperm does not have any mitochondria in it. You are 100%
Those
mitochondria
lazy little
maternal.
freeloaders, those little lazy freeloaders. Just kidding, guys. Just kidding.
They need to be fast. They're really funny under the microscope, let me tell you. They're hilarious to look at sperm.
I
They're
bet.
funny as can. Oh, I mean, you have. It's almost like seeing guys. You have the ones that are focused. I'm going there. I'm going there. I'm going there. I'm going. I'm going. Then you have the overly excited, the ones that are just like, I'm excited to be alive. They're just shaking in itself. Then you have the one that smokes some weed and they're just following their tail. Ooh, look at this cool tail. This tail is so cool. It's it's hilarious to see them in the microscope. But they're slim and trim, so they can run and get there fast. And hopefully the best will win the race and get the girl, the egg. So it is the girl who provides all of the mitochondria for the baby. So very important to support that part as well.
Well, excellent formula. And I've used it for some clients of mine that had been diagnosed with PCOS with really great results. So the
Yes.
myo-inositol, such key and keeping blood sugar balanced. And, it's funny how we segregate out the body because when you hear something like PCOS, everybody thinks it's a girly issue, right? It's a hormone issue. And it is, but it starts with insulin resistance. It starts
Correct.
with
It's a
metabolic.
metabolic
That's right,
issue.
metabolic dysfunction. And guess where that all comes from? Yet again, the liver, the digestion, like you keep saying
Correct.
it, right? So I hope people are understanding that although the allopathic does segregate out the body into
Yes.
these sections, like here's your
But it's
uterus doctor
it's
and here's your,
all intertwined.
it's
And
all, and that's why it's so important to see somebody like you who really understands the function of the body, but has an expertise, right? So
yeah,
it's
so I find myself being a hybrid. And for my allopathic, friends and colleagues out there, the way, traditional medicine has great things. You know, drugs provoke a biochemical reaction. You can do that short term. You want to manipulate something short term in order to obtain X, Y, or Z, sure, that's okay. But you have to come underneath that with something more long-term. Allopathic medicine is great for acute issues, acute problems. Some people simply need surgery. It's simple as that. But what are you gonna do around that? So the way I see all of this is just tools in the toolbox. And the more tools you have in the toolbox, the better you're going to serve the patient you have in front of you, because we're not all one size fits all, and the needs, the likes, what that patient is going to do. I can have one patient, you got to meet the person where they are. So, you can have one patient be fully committed to an enzyme program to dissolve her fibroids, and she's going to do the right thing, and she's going to do the right diet, and she's going to do the meditation, and I'm going to throw everything at her, and she's going to do it and succeed. But in order to naturally get rid of fibroids, it's a 9 months to a year commitment. A lot of times it works, yes. And so you're going to have that person, and then maybe I have somebody that is not as committed, or some that is zero committed. With that patient, I'll be like, honey, let's just schedule your surgery. we'll fix this, because obviously this is where you are. And then I'm going to try to then tell her, okay, we're going to fix, you're having heavy bleeding due to fibroids. We're going to take them out. And then how about we meet halfway? Let's try to help you heal from that. Let's try to get you in a nutritional pattern where it's more nutrition, more helpful to your body. I usually will say either you invest in living or invest in dying.
Right.
So how about we invest
Telling
more in the
yourself,
living side?
that's right. And I always tell people, disease takes a long time to create and it costs money to do it, and so does health. So choose where you're going to spend and how much time you want to invest and which way you want to end up, because it all takes time and money. So
Exactly.
I did promise I was going to ask you about the COVID vaccine, and I am. So I know we're a little bit over time. I hope you have just a couple more minutes. We didn't get to all the beautiful things we want to talk about today, but I guess we're just going to have you come back again and talk more women's
Again.
health and fertility and all
And
the
of
fun
course,
things.
and it will be kind of cool if people could reach out to either of us with specific questions. That's always very useful. Things that might be
Absolutely.
of interest, and we can probably even do a Q&A later on. But
That's
yeah,
great. I'll make sure that I link your information in the show notes. So if you guys have questions or you want to make an appointment or talk to Dr. Verdiales, her website will be here, and any other links that she provided.
absolutely.
So what do you think about the impact of the COVID-19 vaccine on fertility, both men and women? This is not to bash those that took it. I
Correct.
think health freedom is for all choices. I
For
just
all
think it should be
choices.
an informed choice. And so I'd like to hear from a medical physician who is a specialist in fertility, hormones, hormone management, and all things, what you feel
Absolutely.
you've seen.
So, all right. So let's talk about health freedom, and let's talk about so many things that were involved in the so-called pandemic of the COVID-19. And I like to see it as anything that's drastic and full of fear. It makes very hard to navigate the waters. They get murky. So it's like having a cancer diagnosis. It takes a good pair of balls or a good pair of ovaries to break loose from the system, break loose from the fear mindset, and really analyze what you have ahead. And because of that, I do respect and try to not get involved, whether you believed in it, not believed in it, vaccinated or not. I'm here to help you and support you, just like you, Tracey, through the aftermath. But the aftermath is pretty dim. What I was seeing and still seeing, but especially during the pandemic, is that not only the COVID itself, okay, so having the COVID infection was severely impacting women's and men's fertility and and organ function, whether they wanted to get pregnant or not. But then the COVID vaccine was doing the same. And then when you had somebody that had COVID and then had the vaccine, it seemed to have a potentiation factor. I'll give you an example. We have 15 ladies in the office, and we all pretty much ended with COVID at one point, and 100% of them had irregularities in their periods after COVID, including me. I mean, just months of like the period was gone, tangible decrease in ovarian reserve, measurable through lab, not only clinically, but also measurable, like a massive dip on ovarian and testicular function. And I could see it. Like I had a patient come in, a couple. um, the workup showed, so we had before and after, the workup showed totally perfect semen analysis. She was the problem, okay? Let's put it that way. And so we were working with her and focusing on her, and they decided to do artificial insemination as their first step. And it happened to be that he had the COVID vaccine the month before they had the insemination. When he came in for giving the sample, in order to try to impregnate the wife, his semen analysis, every parameter was like awful. There's several parameters that we look at. We look at total count, concentration, motility, progression. So motility is that they're actually moving. Progression is that they're moving forward or in the right direction. And morphology, which is the anatomy of the sperm. A lot of morphology issues with COVID and the COVID vaccine, meaning a lot of abnormal sperm. Count decreased, total count, and obviously concentration count. I've seen it go down. In him particularly, he was already low normal. So low normal would be 20 million sperm. And when he came in, he only had 10. That's a 50% decrease. And then when you add the fact that his morphology went down, meaning not only did the count went down, but the normal ones went down as well. So that means that out of those 10 million, he ended up having maybe one or two that was good. So that was mind blowing because it was so tangible, right? Like we had more than one pre-COVID vaccine test on him showing completely normal semen analysis, or normal range, because, like I said, he was low normal, but still normal. And then post vaccine exposure, just like crazy. And it takes a few months to recoup from that. It is a big insult on the body. So it can be, not to have a doomsday type of thought process. It can be healed. Our bodies are amazing. And I know that you have multiple programs to help the vaxxers overcome whatever happened to their bodies and clear out any traces of some of the stuff in the vaccine, but definitely a tangible impact, both from the virus as well as from the vaccine.
Wow.
So if the intention, there's all these conspiracy theories out there, blah, blah, blah. If the intention was population control, that definitely population, maybe not the way it was intended originally, but definitely there will be some long-term sequela from this, from an already decreasing birth rate. We're going to see it more and more in the next decades.
Yeah, totally. Well, I appreciate you having the actual clinical evidence and seeing that, but also that you can help in those areas with formulas like this, with even some medical intervention. There is a way. God always makes a way.
Makes a way.
I want people to hear that today. I want people to hear that if you are struggling, there are practitioners out there that are helping people post-COVID vaccine have beautiful, healthy little babies.
Absolutely.
Keep you up all night and make you worry for at least 18 to 27 years and beyond.
Correct.
So,
yeah, and beyond. You're mommy until you die. Not the kid, you die.
That's right. That's right. Yeah, I always tell my kids, you wait, you'll understand why I'm so crazy.
Yes.
So, well, Dr. Verdiales, you have been amazing. We so appreciate your mastery in formulation, which I'm just going to say that UTR, when I saw that, I texted Jamie in the group and I was like, have you realized what you've done here? Like, I was like, I'm blown away. And I couldn't wait to start putting it out to people that just
Yes,
popped in my head that I knew it would benefit. So I really want to thank you for that and for your diligence of your self-exploration of coming from the allopathic side, which is not bad. It's just a different path
it's
to
a
more of a
different tool
lifestyle.
set. Hmm.
Yeah, and you need it. We do need it. Um,
Correct.
it's just we always say, pharmaceutical repression and organ removal shouldn't be a lifestyle modification choice. Like it
Correct. It
should
should
be a
not be the
lifestyle
knee-jerk
choice.
reaction. It should not be the knee-jerk reaction. It should not be the first thing that we try. And patients need to know they have choices. And that's the other big thing. It's okay to fire a doctor. If your doctor is not a good teammate, it's okay to let them go, and you can do it with love. You can love people from a distance. It's like, thank you for your help. I appreciate, but we're not aligned in the
Yeah.
same mindset, and I need to find it myself a different physician, and that's totally okay. And their choices they're even saying no, okay, to the most logical choice is still your choice, is your body. It should be your choice. Educate yourself. You are going to always be your best advocate and your best doctor. You live with you 24/7. You know your body's best. And you find a physician that cannot honor that and cannot listen to what you have to say, then they can be part of your healthcare team. As simple as that.
Yeah. Amen. You can fire your doctor. I love that.
You
I
can
just had
fire
one
your
the
doctor.
other day who,
I mean, it's a hired the same way as you hire a lawyer or an accountant or a secretary. You're really hiring a doctor. And so
absolutely.
if they cannot, again, be part of your team because they don't fit well and don't honor you and respect your belief system and your values, then it's okay. Bye bye. Next.
Well, thank you so much for being here. We're definitely going to bring you back for another topic, but I hope what people learned today was that there are some common issues within women, and there's some normal things that happen that are being touted as not normal,
Normal.
and knee-jerk reaction of pharmaceutical repression or organ removal. We don't need to do that and call it care. We can ask better questions, seek
Correct.
out information, things like these podcasts, having an
Right.
appointment
And
with Dr. B.
always, the least intervention will always be the best intervention.
I love that. Well, guys, thank you for being here. Make sure that you
Thank you so much,
subscribe.
Tracey.
Uh,
For those of you listening out there, the best way to reach me is probably social media, Messenger, Facebook. I am scarily very easy to find with my last name. And otherwise, Tracey will provide the information if anybody has any other questions.
Absolutely. She just opened Pandora's box there. She said, message me on Facebook or
I
Instagram.
know
Yeah,
my
here it comes.
my patients do that all the time. It's easy. Of course, I tell them also if it's a quick question, it will have
Yeah,
a quick answer. If you have, like you said, if you send me a paragraph with lab results and da 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 da, I will make sure that the staff gets the information such that we can set up a talk.
that's a great idea. That's right. More than 3 questions is a consult. So make sure that they know that. But thanks again, guys. Make sure you share this podcast with somebody that is struggling as a woman, or even
Struggling.
with fertility, menopause, a teenager that has issues, share it with the mom, because there are things that we need to talk about. And for those of you that may have had COVID and or the vaccine and you're worried about these things, just know that God does make a way. There's always hope. We've given you
There's
some
always
formulas
hope.
that you can start on. And I'm sure Dr. Verdiales would be happy to talk to you. Reach out to her, please. So thank you again. God
All
bless you guys.
right.
God bless you, Dr. V. And we will talk soon.
Bye bye.